Hi, I'm Irvin Eisenberg, coming to you from the Resilience Occupational Therapy Clinic. And in this video, I wanted to talk about top surgery or top gender affirmation surgery. Um, First, I'm going to just quickly describe what that is. So top surgery or gender affirmation top surgery is a surgery to reshape the chest. So those who are not feeling comfortable in their body are being able to reshape their chest to better fit their sense of self. This is often for people who are transgender or gender non-binary, masculinizing their chest, so removing of breast tissue. I want to be clear that I'm a cis male occupational therapist, and it is not my intention to tell anybody what their experience is, but to share my experience with working with these types of scars and this type of client base. And hopefully in this video and the follow-up videos, you'll have some perspective that will help you with your own healing or better understand those who are healing after this type of surgery. These scars are unique in that which we'll get into a little bit later in this video, in that they are a life-affirming scar. They are part of what the person seeking this surgery has been wanting, and the scar is a side effect of that. That doesn't mean there can't be irritation or other things challenging about the scar, but there is something different about that than other types of scars that I might work with. So a lot of surgeries can be traumatic. This is in a specific way that usually there is an event or a fear of an event that might happen. So you may have had an accident or some medical complication, or you might be really prone to breast cancer. So you have your all of your breast tissue removed in order to avoid getting breast cancer. And these are medical interventions that can be very important for folks, but have a sense of loss to them. It's been my experience that in working with folks who have gone through this gender affirmation surgery, that this is not a loss, this is a gaining of their self-identity and a celebration. That these surgeries are life-affirming, that having the contour of the chest that fits your identity can really help you move forward in the world with confidence. Of course, everyone responds to surgery differently, and that's not to say that there isn't some difficulty in recovery like any surgery, and everyone's got their own lived experience. It has been my experience that for most people who have been through this surgery, that they have a support network around them that is helping them with aftercare and is really supportive. I'm imagining that this isn't the case for everyone, but often in order to feel safe going through such a surgery, having a community that supports you is both important and has been my experience that people have. If you don't and you're considering the surgery, just consider what kind of network you can have, or if you're an individual who might be able to support others, what can be your role in supporting people in aftercare of this important surgery. If you've seen my other videos about scar work, you know that I have a little bit of a different approach of viewing scars. I think of scar tissue as a very important physiological response that our body has to injury or insult. And that being able to scar is an important physiological response for us. The problem becomes when that scarred tissue is holding things down and keeping us from moving forward with our recovery. And to keep us safe, how do we appreciate that and move forward with our healing process? So there is a degree of compassion that I like to have people have for their scars, and an appreciation that I feel like sets the groundwork to then help change that scar tissue back into what we want, or to embody that scar tissue in a way that isn't harming us. So the scars that people have from gender affirmation surgeries, there can be complications of them, of course, but it's been my experience that they just have a little bit of a different response to it. But exploring that is an opportunity to help more fully embody yourself. So if we're talking about mastectomies, removing of breast tissue, as I described later, we have two different types of mastectomies, reasons you might have them. One or 3 if you're talking about breast reduction surgery. So folks might have breast reduction surgery where, for whatever reason, they were not wanting their breasts to be as large as they are. Often that can be due to back pain or other challenges. There are people who have breast augmentation as well, which is another, one could argue, a form of gender affirmation surgery, but that's not what we're getting into today. The removal of breast tissue for cancer, because someone either has cancer or they're at high risk for cancer, presents itself very differently than removal of breast tissue to masculinize a chest. All people have some degree of breast tissue, at least initially. If we remove all of our breast tissue, we have a hollowing out and this unnatural look to our chest that looks problematic. It doesn't look masculine or feminine. It just looks like there's been removal of important tissue. So if we're masculinizing a chest and someone is going from more breast tissue to less, the idea is not to be hollowing out like we might with a cancer surgery, where you're removing all that tissue. And I have found that cancer-related surgeries, there's a lot of grief and loss in the sense of might not fit the gender the person now feels. They've lost their breast tissue. But also there's this hollowing out and loss where that those scars are tougher, they're more deeply invested, and it can be quite traumatic. The gender affirmation scars, while they can have their own complications, that by not hollowing out and removing all the breast tissue, you're making a more healthy contour look to the chest than you might with other types of mastectomy scars. So I find it to be a very interesting process to be looking at what is the new landscape and how do we make that as healthy of a landscape as possible with the scar that we're working with. There's a lot of different things that you can do regarding scars. I encourage a gentle exploration of your scars, not trying to force tissue and break up the tissue and not appreciate it, but appreciate that this tissue is here. I often encourage people, as I was saying, it's important to touch your scar and feel what it's like to touch above and below the scar and that integration of the scar and embody your chest. In general, I encourage that for scars. People have a tendency to not want to explore their own scars. That's a thing that they don't want to think about. In gender affirmation surgery, people tend to be a little less resistant to touching their scars because this is a surgery that they sought out to affirm themselves, and that can be an appreciation and an exploration of that. So in closing, I just wanted to talk about the fact that you can seek out healthcare practitioners like myself to work on the scars. There are not a lot of people who use this particular philosophy that I do in working with this type of scar. You can have a good social network, and you can learn to touch your own scars and integrate them in a compassionate way. If you want to learn more, I encourage you to check out my other videos on this channel about scars in general, and then I will talk in the next video a little bit about touch for your own scar, specifically for this type of surgery.